Hey guys, it's Evan again, your Paramedic Coach, and today I want to talk to you guys about CHF versus pneumonia. How do we differentiate these two things? You're about to go to Paramedic School. You may even be in Paramedic School now if you're watching this video. Now, how do we differentiate between heart failure, acute congestive heart failure, and pneumonia? And we know they both have rails. All right? If you hear rails in the bases, it could be pneumonia or CHF. If I told you you have a 78-year-old male who presents with bilateral rails, the first two things that would be going into your head would be acute CHF, pneumonia, right? Now, how do we differentiate the two? Today, I'm going to give you some clinical tips and pearls about this. So let's start with CHF. A clear-cut CHF patient will look like this. All right, here it is. They may be coughing up. Well, actually, before that, let's talk about this. If they have CHF in their history, if they have high blood pressure in their history, they have heart failure in their history, that starts you down the pathway right there. As I walk up to someone and they're having a hard time breathing, one of the first things I do is say, do you have a history of asthma, COPD, or CHF? And they'll say, no, 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 or yes, yes, yes. All right? So that's number one. Do they have a history of CHF? Number one, of high blood pressure, any cardiac risk factors? Go from there, okay? Are their legs swollen? Do they have edema in their legs? We already got the rails down pat, right, in the base of the lungs. Got that already. Now, what else? JVD in the neck. Big honking JVD, all right? What else could be going on? Think about it. High blood pressure. Okay, so here's a classic CHF patient. Your patient is a 78-year-old male patient who has a history of CHF, high blood pressure, right, high cholesterol, all right, who presents with bilateral rails, a blood pressure of 200 over 100, difficulty breathing, chest pain, okay, edema in their legs bilaterally. That's gotten worse in the last few days. And they have JVD on exam. What's wrong with the patient? CHF, okay? Now watch pneumonia. Your patient is a 78-year-old male patient who presents with bilateral rails, with chest pain and difficulty breathing. Okay, fair. Now, the leg exam is normal. Patient tells you they've been coughing up green and yellow sputum for the last few days, and they just feel extremely tired and short of breath when they walk around. You may even notice the rails is on one side versus the other, because pneumonia, if it's on one side, it's not going to be rails on both. And you could have bilateral rails. Bilateral pneumonia. That can happen. But most commonly, it's on one side. So that's another way to differentiate it. And normally, they're normal tensive. They're not going to be 200 over 100. They'll probably be normal tensive. Or if they're getting septic, they'll be on the lower side, right? Okay? So that is how we differentiate. Now, remember this, when coughing up stuff. Now, let's say they both have a productive cough. Well, if one has blood, or one has green and yellow sputum, pneumonia. Blood, red, pink, frothy, CHF. All right? So that's how we differentiate that stuff. You know, and it really comes down to, the exam and the vitals. Now, do these patients get 12 leads? Of course they do. Now, do they get routine ALS? Of course they do. Now, if you went through all this and you're still unsure, what do? So now I want to give you guys a pro here. If you're unsure, maybe they have diminished lung sounds. Maybe you can't hear the lung sounds well. Maybe they're morbidly obese, and that's getting in the way. If you're unsure if it's CHF or pneumonia, what should you do? I offer you this. Routine ALS them, do an EKG, get your blood sugar, get your vitals, put an IV in, keep their oxygen levels above 94%, and transport. Now, this is my opinion here on this one. This is not from the medical textbooks. This is literally my own personal opinion on this. What I do in my practice is this. If I have this happen, where it's CHF or pneumonia, and I'm unsure, I've had patients that say everything that I said, they check them all. They say, oh yeah, green and blood and this and that, and they all check. You do what I just told you, routine ALS them, all right? Keep their vitals in normal limits, whatever you need to do. Now, don't give albuterol, okay, obviously. If you're unsure, okay, with pneumonia or CHF, don't give albuterol. Because if it's CHF, you just killed your patient, all right? We just need to get them stabilized, get them to the hospital. They're going to do chest x-rays, they're going to do other stuff at the hospital, they're going to get blood work back that will tell us exactly what's going on. Could be either one, you know. So now, what could you do? Could you give nitro to this patient? Would that harm them if they had pneumonia? I would say no, as long as the blood pressure is maintaining fine. And I've done that commonly. I've done even a cross pathway where I said, all right, I'm not really unsure at this point. I'm going to give, I've had patients who have asthma, COPD, CHF, and pneumonia. They check all the boxes for all of them, and the lung sounds just cannot hear them. They're just not there. Can't hear them. But they're not trucking a breathe. They're just kind of sitting there. That's when you got to go a little bit of both. Give some nitro, say Medrol, whatever. Okay? You're practicing medicine. Practice it. So when you're unsure, go on the safe side because you don't want to overdo it and give someone with CHF albuterol. That's the main tip. All right, guys? Guys, I'll see you next video. CHF versus pneumonia. You learned it here at the Paramedic Coach. See you next time.